Shaneeka James, America's Minority Health Network President and CEO. Well, the hurdles that I see that still remain for the industry of digital signage is just building an alliance with the advertising agencies at this point. I think that there is a lack of comfort that still remains within the advertising agencies when it comes to digital signage. I don't think that they really understand the customization as well as the maximizing points that they can reach through using digital signage at this point. So I do think that it's still our jobs as networks as well as content providers and so forth to allow the advertising agencies to have that comfort so that when they're taking the proposals back to the brands that they can understand that this is something that they can really customize to get their marketing message out to the consumer. I think at this point, by using digital signage to broadcast health education to the patients, it allows the ability to diversify the message that might be needed for each facility. Health education is very important to me and I'm very passionate about it, but at the same time I know that one message doesn't carry over for everyone. For instance, at America's Minority Health Network, we gear toward healthcare disparities that are for minority patients. So we have to be very sensitive and very direct toward our messages that we are giving. Otherwise, the message really doesn't hit home for them. So I think that's something that's really important right now within our industry is health education as far as using digital signage within the health education sector. Next big thing, once again, for me is digital signage in healthcare. I think that in the healthcare facilities, they're starting to utilize navigational systems to make things a little bit more easier for their patients, as well as using the health education monitors to educate the patient, which is producing recall of patients to come back to the facilities. So that's what I really feel like that's the next big thing for us. The best thing that I've seen yet was the sneaker store that you can rotate your selection of sneakers. It's a large wall, so versus it being a sneaker store where you have a physical sneaker on the shelf, it is all digital. So you're pointing to the sneaker that you want, you're picking your size, you're customizing it, you're making your order. I think that that's amazing. Our network is America's Minority Health Network, and we have 225 screens deployed already. We are nationwide, going all the way from New York back to Los Angeles. We look to just have a steady pace at this point. We don't want to just flood ourselves with so many subscriptions that we can't really maintain the high quality level that we've done thus far. So our thing right now is just being steady, attending our National Medical Association conventions and working with our partners that might be there that might want to work with us as far as to get the message out for health education as well via digital signage. Okay. I've already been certified for 2 certifications. I'm a digital signage certified expert, as well as I did my certification this week for digital signage display expert. And on tomorrow, I'll be doing the digital signage network expert. So I'll be fully certified at that point in every aspect. I think that Alan Braun and Jonathan Braun, they do a wonderful job educating us here and getting us certified. I think that they're doing something for this industry that is really needed. We need to know every aspect of digital signage. We shouldn't just be network providers or content providers. We also need to be educated about, what it is that our advertising agencies want to see, what it is that the makeup of digital signage is. We need to be educated on all of that, and that's what they're doing for us right now. I'm very excited to be certified. I don't know of any other company that offers certification, especially not within an environment that welcomes it. When you're here at the Digital Signage Expo, you definitely want to know the business and you want to understand the things that are being displayed. I believe that certification gives you an opportunity to understand the ins and outs of the business. I see the Digital Signage Federation acting as a medium between us and the advertising agencies, as well as the brands, as well as the consumers. I feel like it's their responsibility to let people know that we are here. and we're not going anywhere. And if you're not getting on this train, basically you're going to be left behind. That's how I see it. And I think that the Digital Signage Federation has done an amazing job. I'm very proud to be a member of it, and I'm very proud to be active. I'm Shaneeka James, President and CEO of America's Minority Health Network. I'm here at the Digital Signage Expo. Where are you?